Hi, I'm Dr. Jolie Silva, clinical psychologist. I'm also the clinical director of a private practice called New York Behavioral Health, based in New York. I work a lot with mothers, and one of the things that I do is help mothers balance and thrive and help them to make mommy moments count. Now, we're in the middle of a pandemic, so words like balance, words like thrive, those things seem almost impossible to be happening right now, right? Um, there are just so many things going on. And in prep for back to school, normally we're focusing on Spider-Man backpacks, and now we're looking at Spider-Man masks. And I think what helps me working with my clients, besides being a psychologist and doing this for many years, is that I'm also a mom. So I 100% understand on a different level what it is like to be going through this. I work, I have kids, I get it. So questions just keep coming up, all different kinds of ones. What are we going to do about wearing masks? Are we going to pod? What if my kid is anxious? What if my kid is becoming socially isolated? What am I supposed to do as a mom? How do I balance work? It's endless. So what I thought might be helpful is to go through some questions that I've been getting from different people, from clients, and go through them one by one and see if I can offer any guidance. There are no right answers to anything right now. We are really in unprecedented times. There's not a lot of research about what to do in certain situations because this has really never happened before in this lifetime, really. The last one was so long ago. We're just in different times. So I'm going to go through some different questions and let's see if I can provide any help to any of you going through this really difficult time for us and for our kids. I want to send my children to school, but I am afraid they will get sick and I don't feel like it's safe. I don't know how to make the right decision and I'm feeling overwhelmed with anxiety. How can I get through the stress? Okay, so I really see this question in three parts. The first question is, I want to send my children to school, but I am afraid they will get sick. How do I make that decision? That's a tough one. I was up until 1 in the morning the other night trying to make this decision myself. This is not easy. When you make any decision, a good recommendation is to first make sure you are clarifying your values. What is important to you? And if you have a spouse or a partner, to sit down and see if both of you are on the same page with regard to your values. And values might be your child's mental health, social emotional health, physical health of your family, financial security, being able to continue your career, right? These are all things that play in. And when you go into it, really knowing and accepting that something has got to give. There is no way in this situation that you can make a decision that fulfills all of your values completely. It's not possible. We need to start giving ourselves a little bit of a free pass here because it's just not all going to happen, right? So you sit down, you look, what is important to us here? How are we going to prioritize things? You weigh out the pros and cons of each decision. And in the end, being firm on the decision. I think once people make the decision, there is this huge sense of relief. Like, I've made the decision. I'm sending them. Made the decision. I'm not sending them. There is a sense of relief. I've done it. Okay. And then an acceptance of this is what I've made right now. And I'm going to do the best I can to stick with that decision. And the absolute worst case scenario is you wind up going back on the decision. And that's okay too. That is perfectly fine. So the decision making is a tough one, but being on the same page as a spouse seems to be an issue that's coming up. Some couples are more on the same page about it, some are not. But really looking at what your values are and the goals you're making in terms of the school decision, are they in line with those values? And then the second part of this question is, I'm feeling overwhelmed with anxiety. How can I manage this stress? Which I am hearing all over the place, not just with my patients, but with friends and family. Anxiety levels are heightened across the board. Frustration, irritability, sadness, they're up. Everything is up, right? So how do you manage the stress and anxiety during this time? What I highly, highly recommend, even if you feel as though it is completely impossible to do this, is to set aside time where you are alone and doing things for self-care like practicing mindfulness meditation, doing yoga, exercising, deep breathing, relaxation techniques, as a way of managing the anxiety and stress, making it a priority to schedule in meals for yourself, not eating the leftover chicken nuggets and then grabbing something out of the fridge, which I'm guilty of doing all the time. Planning for those things. I know it sounds like common sense, but I can't tell you how important this is. Making sure you get enough sleep. Again, I know it sounds like common sense. There is so much research on how sleep helps in all these different areas in management of anxiety, depression. So the basics. Take care of your basics, your sleep, your eating, your exercise, to start there. Social support, sense of community with other moms is also key to something like that. With everything going on, my child is scared to go back to school this year. How can I help them feel more at ease? That question is pretty interesting to me because while that might be the case for some people, I have found overwhelmingly that children are super excited to go back to school and have some hesitancy about wearing the mask. But you have a range of reactions to all different kinds of things, right? So this question is specifically about children who are scared to go back to school, and it's tough because we don't want to create a phobia, a germ phobia in children, yet we all have germ phobia right now to a certain degree because that is what the environment is calling for. So I think a rational education to your kids about what it means to spread germs, what social distancing means, if they touch something, not to go into a panic. You touched the mail or you touched a box, right? Not pairing germs with a panic response in front of them. Because we don't want them having then that panic response around those kinds of things, but just educating them about this is what's going on right now, educating them that this is temporary, educating them that eventually things won't be like this anymore, and working through with them any anxieties about the germs. My child has a lot of friends at school, but isn't close with one person or group. I have noticed that as other kids have started to socialize in small groups online, she hasn't been invited or included. How can I help her feel more connected to her peers during distance learning? Okay, so when there are issues of children being excluded or not included with friends or having some social difficulties, my first questions are always, do we think it's a social cue deficit? Meaning they just don't pick up on those nuances of social communication the way some other kids do. This question says that the child, when in school in person, seems to do just fine, which makes me think that is not a social cue deficit, but that would be a determination that a psychologist or another mental health professional would have to make. If it is a social cue deficit, then things like social skills training would be helpful. If we think it is more of a social anxiety, which shyness would fall under that category. That's a different story. It is a social skills deficit, but it is not a social cue deficit, right? I understand how to have a conversation. I know the ins and outs of when to talk and when not to talk. I know when to smile and when to laugh and how close to get to people. It's the anxiety pieces. I have a fear of having some kind of negative evaluation or negative judgment of me. Therefore, I hold back and don't put myself in that situation. Okay. So now this question is about forming these virtual friend groups, right? And then a child not be included. And I've seen this. I've seen this in my practice a number of times over the course of the pandemic. And what I recommend is, as a parent, having the parent gently encourage the kid to reach out to specific people in the friend group separately to form these bonds maybe not necessarily in the group. Like maybe there is some kind of discomfort being in the group, but your child really likes this one person or really has a special connection with the other person. And to encourage, you reach out to this person separately and then follow through. See, that's the thing. Following through without nagging about it. This is like a fine balance, right? So it's, how do I encourage my child to reach out to somebody? How do I say, oh, how did it go? And follow through without being a nag about it. So there is a balance to all these things, but reaching out to individuals sometimes is less intimidating than reaching out to the group as a whole in order to foster friendships. And look, not every kid needs to or thrives in being in a group, a friend group. Some people are perfectly content and happy having a couple of close friends, and that's it. And you have adults like that. Not everybody is, wants to be the center and in the party and part of a larger group. Some people have smaller groups. So also trying to figure out what it is your child really desires in their social world. I hear some parents in my neighborhood talking about doing learning pods, which I can't afford. How can I manage my guilt around not being able to provide my child with the same opportunity? Ooh, cue that mommy guilt. It gets you at every turn, doesn't it? Every turn. Guilt is this belief that you've made a mistake, that you've done something that is not congruent with your values, and then some extreme belief about that mistake that you think you made. Not being able to afford a tutor is not a mistake. You didn't do anything wrong. That is not a mistake. You're doing the best you can, and to continually remind yourself that you're doing the best you can will help counteract any guilt you might feel. Mom have guilt because I stay home with my kids and I don't work, so I'm guilty because I'm not providing them with a model of a working woman. Working moms have guilt because I work and I'm not there for my kids as much. It doesn't matter. Moms are going to find guilt in anything they possibly can. Not being able to afford a tutor or a pod or a home teacher is not a mistake. It is the circumstances, and there has to be an acceptance of, I am doing the best I can with what I have, and letting go of those feelings of guilt, those feelings of shame, those feelings that come up when you feel as though you are in some way lacking, or you have in some way made some sort of mistake. You haven't. You're doing the best you can. And so when we move forward through this pandemic, who knows what is coming at us, learning to change the things you can and accept the things you can't is the way to go, and a balance between the two. I feel like my college-age son is not taking COVID-19 seriously enough. How can I get him to take this seriously and respect the dangers of the pandemic, especially when he goes back to school? Tough one, right? We got lots of people in that age group not taking it seriously. Remember, the adolescent brain develops until age 26, not 18. You're really dealing with a developing brain that still does things like magical thinking they're invincible, egocentrism. So sitting down with a college-age student as a parent in a non-critical, non-judgmental way, because if you come at it with, how could you do this? Don't you take this seriously? You're going to get defensiveness. You're not going to get anywhere. And you might be angered, and you might be bothered, and you might be upset that your child is doing things like this. But at the same time, you don't want to create this defensive back and forth, because you're not going to get anywhere. If your goal is to get your child to take COVID-19 more seriously, then coming at it in a harsh, demanding way it's unlikely you're going to achieve your goal that way. You're going to get defensiveness, and you're going to get more of the same, if not worse. So sitting down in like a neutral, kind of non-judgmental way and saying, well, let's just talk through this. You're a human being. You're an adult, technically. Talk me through this. What are the things that you value in your life. What is important to you? Family, friends, school, okay, naming those things. And let's go through, what are the things that you'll think you'll miss out on, okay, if you follow the quarantine rules. I'll miss out on partying, I'll miss out on this, I'll miss out on that. Okay. And then if you behave in the way you continue behaving, what are the possible consequences of those behaviors? Like, we call it consequential thinking. Let's think this through. What are the possible consequences of you going to these big parties, of you not wearing a mask, of doing all the things that you're doing? What are some possible consequences, and how does that impact every family member of yours, let's say? Because you say you value your family, right? So how does that impact your brother and sister? How does it impact your parents? How could it impact your grandparents? What are the possible consequences of your behavior? Getting them to see, right, if I do this, that there is a chance that it will lead to that, which is a pretty negative consequence. And what is it that you're scared of missing out if you don't do these things? Well, I'm just, hanging out with my friends, and then they'll do stuff and I won't do it. And we got FOMO going on, lots of that. And then working through, well, how can we find a balance here? How can you still continue to have some social interaction, but not put yourself and your family at physical risk? And talking about it in that way. A collaborative discussion, not a finger-wagging discussion. So that's our last question, and thank you so much for tuning in. I hope you found it even just a little bit helpful. We're going to do another blog in a couple of weeks about general mom questions for COVID-19 that have to do with stuff even outside of the school area. If you have any questions, any comments, please feel free to reach out to us. We have a number of therapists available at New York Behavioral Health who deal with children, who deal with moms, who deal with parenting, and we're happy to help in teletherapy format right now. And please feel free to check out my website, which is joliesilva.com, or the practice website, which is newyorkbehavioralhealth.com. And thank you so much for tuning in.